Thank you very much, Francesca. Thank you to Julio for organizing this workshop yet again in a stellar program and distinguished faculty. I'm very honored to be here. I also wish to acknowledge Julio for his visionary leadership around 90-90-90. He, Michel Sidibe, others such as IAPAC's own Ruben Granich and others have been at the vanguard of pushing this target, decisive target, for this last several years, and tremendous progress has been made to date. I'm here to speak to the perspective of our membership. We represent 27,000 members in over 150 countries now. And for those of you who are not familiar with our work, it includes advocacy, education, but also special initiatives such as our Fast Track Cities initiative. So I will shamelessly plug our satellite meeting tomorrow morning on Fast Track Cities with the cities of San Francisco, Kyiv, and others, and glad to advise you that Durban is one of our Fast Track cities. So I'm speaking to the perspectives of our membership on 90-90-90, the barriers and opportunities that exist, and there was no better way of finding out what our membership felt than to issue a survey, an invitation to participate in a survey. We had thousands of individuals submit their thoughts on any number of varied issues, from whether 90-90-90 was possible to what people felt was needed to facilitate the achievement of the attainment of the targets. Before I get into some of the results from that survey, though, or some of the thoughts, just a reminder of some of the program interventions that we are all engaged in one way or another in order to achieve 90-90-90 as important zero stigma and discrimination. This is really the foundation for Fast Track Cities, and a lot of the work we're doing promoting interventions at various points across the continuum of care, but on a foundation of political commitment, community mobilization and engagement, all-important health system capacity building on the workforce, which Carlos will speak to, in an effort to ensure equal access to interventions among all populations. So challenges and opportunities. One of the key messages delivered to us by our membership was the one about optimizing the HIV care environment. A huge issue that we addressed in our 2015 guidelines on optimizing the HIV care continuum was the elimination of laws that criminalize HIV exposure, the conduct of key populations, including men who have sex with men, sex workers, and substance users was brought up. Reintegrating prevention into the care agenda was an enormous challenge raised by our members. In an era where treatment is prevention, what then do we talk about as far as the other prevention interventions? So reiterating the importance of condom use, but also placing PrEP in its proper context, understanding that ultimately treatment prevention has the most impact in trying to attain the 90-90-90 targets. Generating demand. So our membership is keen to get involved in scale-up of testing, care, and treatment programs. In fact, they are doing so already in so many countries. But there's a need for additional education and guidance, and here I'm very grateful to WHO for its guidelines on so many of the issues we're addressing here, from self-testing to community-located care. But one of the challenges, which Ruben will address in his presentation, is that of uptake of the guidelines. Too few countries have actually taken up the issue of test and treat, and that needs to be resolved. Finally, the human resources for health challenge is significant. Again, Carlos will address some of this, but a real need to implement task shifting. In 2008, WHO issued a set of guidelines on task shifting. I was very happy to work with Francesca, Badara, and others on these guidelines. Regrettably, they have not been implemented at the scale that they need to be, and they require some updating now that we're in the 90-90 era. And so task shifting, not just from professionals to lay providers, but also integrating people living with HIV/AIDS and self-directed care and engagement and management was brought up by our membership. Provider perspectives also included a call for us to embrace the decisive targets of 90-90-90, but start aiming toward the next set of goals and targets so that they could be advocates for change as they have been over the last several years. There's a call for data-driven action and an embrace of open data, transparent use of data, so that we can measure the gaps and focus our energy and resources where they will have most impact. PEPFAR obviously stands out as a global program that has done so, but there's a need to do so at every level of the continuum. Political will and financing has been addressed by the first panel. But within the context of sustainable development goals and all of the issues that were brought up in the first panel, including the war on terror was raised for France, there's a concern among our membership that we won't have the resources necessary to do the work that our members are engaged in doing. And so a real call for activism on our part to hold our political leaders accountable for the promises they made years ago, and most recently at the high-level meeting in New York of the United Nations. With respect to financing too, a lot has been said about efficiencies, but I will tell you that the bulk of our members believe they're pretty efficient already. And so I worry, as was raised in the first panel, of the idea that efficiencies will be utilized by donors in order to reduce the amount of funding they provide to the global fight against HIV/AIDS. Eliminating stigma and discrimination was ranked 54% among the concerns that people had about whether we could attain 90-90-90. This should be no surprise to those of you who are in the room. Unfortunately, though, there are not enough efforts currently to measure and mitigate stigma and discrimination, particularly within healthcare settings, and so there's a real need to do so. Finally, we asked our membership, do we have the tools at our disposal to end AIDS as a public health threat by 2030? And the good news is 78% of them said yes. That is significantly up from the last survey we conducted 2 years ago, where we were more at 50%. That speaks to a membership and a clinician constituency that is firmly behind 90-90-90, but they require the resources to achieve what we're asking them to do. I'll close by sharing this photo from a march I participated in yesterday, the AIDS Healthcare Foundation Keep the Promise March. And 13,000 people, mostly here from Durban, came out for this march to talk about all the various issues and address all the various issues that stand in the way of attaining 90-90-90 and an end to AIDS. And so I close by just reminding us who we stand with and why. It's a human rights imperative that we do all we can to attain 90-90-90 and an end to AIDS as a public health threat by 2030. Close by also shamelessly plugging our Geneva Summit, which is in October 13th and 14th, focused on the issue of controlling the HIV epidemic with antiretrovirals. We're very pleased to partner with UNAIDS and AMFAR on this summit. Thank you very much.